and welcome. I'm really pleased to be a part of the People and Planet United Global Health and Purpose Summit, a global gathering bringing together leaders across health, technology, and innovation to explore how we can drive better outcomes for both people and the planet. This session is titled From Automation to Autonomy, Rebuilding Healthcare with Living Intelligence. As AI continues to evolve, we are moving beyond automation towards systems that can learn, adapt, and operate with increasing autonomy. This shift has the potential to fundamentally reshape healthcare, not only in how care is delivered, but in how decisions are made, how systems are designed, and how we think about intelligence and health. My name is Christina Raish. I'm Vice President and Chief of Staff at Fin Partners, and I'm very pleased to introduce a very special speaker, Ganesh Padmanabhan, founder and CEO of Autonomy AI. Ganesh is at the forefront of rethinking how intelligent systems can move beyond automation to become more adaptive, integrated, and impactful within healthcare. His work focuses on translating advanced AI capabilities into real-world applications that can support better decision-making and more responsive health systems. Ganesh, it's a pleasure to have you with us. I'll pass it over to you.
Thank you, Christina. Thank you so much for having me at this wonderful event, and what a noble cause to link the planetary health with human health. So thank you for having me.
Of course, it's a pleasure.
So, well, thanks again for the audience. I mean, I'm excited to talk to you about this shift that is not only is happening, but something that we have to force to happen to take care of people as we have for global planetary health and global human health. So, and I'm going to share a little bit of some stories here, some evidence here on some of this stuff. But I do think that for the last 10 years or so, and we had powerful tools and technology and automation, and we have automated our way through many of the problems that we have in the industry. But it's increasingly evident that that is not enough. You have to move beyond automation to autonomy. And then what does that mean? And I'm going to spend a little bit of time walking through that, give you some evidence and examples. Ganesh Padmanabhan, I'm founder, CEO of Autonomy AI, and we live this world today in the US healthcare system by trying to turn workflows into intelligent living experiences that learns and delivers value in autonomous fashion, so you can reduce the cost of delivering care, improve access to care, and make healthcare equitable for everybody. The reality in healthcare today is that we don't have any lack of automation. We have automation any place. You talk about workflows like care management or prior authorization or claims or revenue cycle management. Automation has been there, and it's the new basis, right? Everybody has automation in all of these areas. But the problem is not just automation. The problem is two things. One, these automation or these benefits that are actually accrues through this automation, these workflows operate in silos. Most of the challenges in a complex industry like healthcare happens when the handoff needs to happen from one workflow, one human being, one team to another workflow or another human being or a team of people. The same data is being processed and reprocessed multiple times, and decisions lack continuity. So you might make a decision about how a patient should behave at the point of care and give them a prescription. The patient goes home, they got their lifestyle things, they have social determinants of health that really truly drives the way whether they're going to remain adherent to that particular medication or not. And we don't think about that as a continuous problem. We think about it as an industry as siloed problems, and we have solutions for SDOH, we have solutions for prescription, but there is lack of continuity across that. And this we've made some progress, with the advent of ChatGPT and generative AI over the last 2 years. Ever since 2022, we've launched a lot of tools. We've launched a lot of co-pilots and launched a lot of further automation, which is not just dumb automation, but intelligent automation. But they answer questions. What you really need to really unlock the value in healthcare for the patients, for members, for providers, for caregivers, and for enterprises and businesses, you have to unlock coordinated action. point solutions that we've had so far do not provide the outcome that we all want, and we hasn't provided. One way if you think about, whether you look at the last 10 years of digital health or health services or health IT, the investors in those things, the VCs, the private equity folks who participate in those businesses, they said that category has done really well. But if you ask the average patient, has healthcare gotten better or worse in the last 10 years? Most people will tell you it has probably gotten worse. Point solutions do not solve those problems. Co-pilots and these things, we've for too long in healthcare, we treat every kind of action, every kind of decision almost equal. So we layered in saying it needs to be human in the loop, it needs to be co-pilots that are assistants and stuff. But in a place like United States, just even the most advanced market, healthcare market in the world, in the United States, we have less than 1 million MDs and doctors taking care of 330 million people. There is giving them more tools to automate more parts of their work helps a little bit, will not change the equation. And if you go to Brazil or India, where even that ratio is even lower, the assistance model of co-pilots assisting and making the person, more productive, the caregiver more productive, will not be enough. And then lastly, I think we didn't have the technology before this, but we now do. The intelligence in these, the pockets of action that we do, the silos of things that we have, we do a lot. There is a lot of intelligence in each of the action, each of the interaction, which is completely thrown away when you go from one place to another place. A patient coming into the doctor, the prescription example that I gave you, and then when they go home and do it, all they have as remnants of that particular visit is a bunch of papers with a discharge summary and a lot of legal language that they cannot make sense out of. It doesn't tell them how they have to improve their lifestyle to do better. It doesn't tell them how can they use their available resources to stay adherent to the medication. It doesn't tell them how do they automate or it doesn't tell them how do they set the appointment they need to have for a follow-up and when and so forth. That shared intelligence layer does not exist today. But we have an opportunity to change it. The shift that we have to do to go make this happen is we have to move beyond task execution, which is automation. Automation was all about take a process, look at that process, and speed it up using computers and compute doing the work than humans having to do the work. We've done that. We have really worked really hard on it. It has made some progress in it. The co-pilots of making it a decision support for the folks in healthcare, be it a caregiver, be it an adjudicator, a claims person, a finance analyst, or an actuary. We've given them decision support with these things. That unlocks a little bit of value, but doesn't really solve the global crisis problem. What we need to do is actually, how do we reimagine these workflows as every single workflow in healthcare or any regulated industry, any industry as old as healthcare is, has been built for humans to perform actions. And over the last 2 or 3 or 4 decades, when we went electronic and made it more digital, they perform actions on a screen going from left to right. What you need, the need of the hour, is autonomy, coordinated learning workflows that are a set of AI agents that are actually performing these different tasks, assisting decisions, bringing the humans in when they need to actually be brought in, and then making sure you're actually autonomously performing complete set of actions needed to drive a particular outcome. Let me give you a simple example. I'll give you a story, a real life story. We were working with a large provider and a health plan. They're an integrated, health plan and provider, if you will. And they were processing PET scans for prior auth requests coming in from patients or providers for PET scans on confirmed cancer diagnosis. Now, traditionally, a request comes in from a patient. You have to review prior authorizations. You take that request, you look at it, make a decision based on their benefits, based on their utilization, based on their course of care, whether it actually aligns with the care pathways and so forth, and do an approval or denial. And usually it's an approval. You approve that and you forget about it. The health plan does not know about this patient going through a cancer treatment for the next 3 or 4 months until the first claim for a radiation therapy or a chemotherapy hits their system. And we have lost time on taking care of that patient as a health plan. Your providers actually send that patient over. The patient is, really going through a very tough time in their life at that moment. They're grappling for whatever they can get a hold of. The first big concern that any patient will have is like, am I going to live? It's cancer. Is it curable, treatable? The second concern they have is like, am I going to go bankrupt by paying for this in the United States system for healthcare? How a coordinated set of autonomous agents can help there is like when that request for authorization hits the payer's doors, you don't look at that as an isolated piece of action that needs to be automated. An AI agent looks at the case, parses the information, updates it in the system, runs it against criteria for coverage and determination, does the approval. And if it's an approval, definitely in all of these cases, you don't want to wait for a human to review it and sign off on it. Automate that approval process, but you don't stop there. A coordinated system of agents then goes and says, we just have information about this member. We understand the risk group they're actually a part of, their patient, what provider network do they have access to, what is their benefit plan, what's the contracted provider network that's closer to where they live, and what is the best course of care for them. And an agent then goes and initiates action by sending a note to the care management team or the coordinator team, and they get a calendar note and they're called to call this patient that afternoon. You go, and another agent goes and looks through provider contracts, builds that whole 6 to 7 months of the care pathway across radiation therapy, chemotherapy, does the math, does the manipulations to actually understand what is the most appropriate course of care for this patient, how much will they have to pay out of pocket to go through this treatment, packages that whole thing, sends it to the care manager. The patient gets a call that afternoon, and the care manager says, I understand you're going through a very tough time. I understand it's going to be really hard on you, but we're here to help you. Here's how we recommend you do. It's your choice to go to where you want to go get care. But in this choice of care, here's how these different pathways, here's how much you'll have to pay. We have already, and by the way, our coordinated set of agents have already called and scheduled your next appointments. The next dietary consultation is actually set up. Your chemotherapy and your radiation therapy sets have been set up. And the whole process, everybody wins. The patient feels better about their course of care. The provider is actually happier that they get to keep the patient within their network so they can take care of the patient and have continuity of care. The health plan or the employer paying for the benefits of the patient has visibility that it is, you're taking care of these patients, they're going through a journey, and they have complete visibility on what that journey is going to look like. Everybody's happy in a system like that. And you take care of the patient at the end of it. This is possible today. This kind of enabling an autonomous operation would not have been possible 5 years ago, 3 years ago, but it's possible today. And we're doing this in many different organizations. Now, if you take this beyond the US healthcare system and you think about the global healthcare crisis, we almost need this level of autonomy, not just AI, but autonomy. 4.5 billion people lack access to care. 4.5 billion of the 8 billion people we have in the world. Over $1 trillion is wasted on administrative inefficiencies across the entire care spectrum. There is a global shortage of over 10 million physicians that we would need by the time to keep up with the population growth and the growth in the longevity of people going up. And unfortunately, there is a huge disparity between a country like the United States or Norway, where you have 48 physicians for every 10,000 people, to a Nigeria, an India, or a Chad. AI and especially autonomy can bridge this gap. You can go from siloed, fragmented systems to coordinated set of AI agents with a shared intelligence layer. You can go from late stage, reactive, episodic care to coordinated, anticipatory workflows the goal is not to treat patients, but keep them healthy. And you treat patients as a means to that end. It is also going to be easier for us to scale the level and the access and the kind of care we can deliver to patients worldwide today with an autonomous set of agents and with this autonomy in mind. And we believe that autonomy will be that global force multiplier to deliver access to care 24 bar 7, irrespective of geographic limits, reaching the underserved in any country around the world, be able to reduce the cost of care. So making sure that, like you don't have the same economics that you need to worry about if you're delivering care in a remote area in Chad, right? We move from a reactive, siloed, episodic system to early prevention and more preventative care. And then definitely we'll be able to multiply the productivity of the clinical and the non-clinical workflows in healthcare to go make this happen. So this shift is real. It is mandatory for that this happens to go make this happen. Autonomy, automation isn't enough. Autonomy is here. Thank you so much for the opportunity.
Ganesh, wow, what a fascinating presentation. And, so many points stood out to me, but I think the one that really mostly resonated is what you said about the global shortage of 10 million physicians and how the disparities in health based on geography could be bridged and the gaps closed thanks to AI. And that is such a hopeful message and a hopeful thought as we look into the future. Are there any last thoughts or things you'd like to say before we close out?
No, no, thank you, Christina. No, I think, look, I'm very optimistic about. There's a lot of fear in AI and workforce, like where the compression of the workflows happens because AI is automating jobs away and stuff. But this is where, like, you think about, like, we're seeing this in coding that I think for the first time in the last few. So coding is the number one bastion of AI, where like it's a workflow that is very highly structured, so you can automate a lot of that. Well, for the first time, we saw that the number of job applications and people hired to do software engineering went up, not down,
Mm,
the last month, in software because of AI. So
yeah.
it's the Jevons paradox, as they call it, right? Wherein it is when you make a process so much more efficient, more people will have access to it, and that increase the demand for people who can actually go do this process. So in healthcare, especially, there's a lot of fear. There's a lot of uncertainty on what will AI do. We are using AI to review cases and prior authorizations. The nurses are worried about whether they're going to lose their jobs. Actually, it's going to be the opposite. They'll be able to serve more people. Everybody in healthcare is there for one reason, to take care of people. But we have worried them with paperwork, bureaucracy, all of that stuff. And this is the opportunity to go do make sure like you take all of that away so they can focus on what they do best, which is heal and take care of people. So I think I think the future is so bright in terms of what we can do today.
Yes, and I want to close on that message that AI is actually going to improve our lives and make things better and make humans more productive and healthier. So let's take that. Thank you so much for joining us today, and I look forward to seeing you very soon.
Thank you for having me.
Bye bye, everyone. Thank you for joining us.